When we partnered with Henry Ford on the Game on Cancer a few years ago, I was hearing a term that really struck a chord with me: financial toxicity.
Yes.
Can you speak a little bit to that?
So it is a heart-wrenching and heartbreaking concept that, imagine that you are diagnosed with cancer, or a loved one is diagnosed with cancer, and that in and of itself is so much to deal with. And you're going to doctor and nursing visits, you might need surgery, you might need chemotherapy and radiation therapy, but all of these efforts around the medical aspect of cancer are dizzying and critically important just in and of themselves. But what gets lost is that the fact that people are taking time off for work, even to get to treat themselves, but to take a loved one, if it's your mother or your father or your spouse, they may not be able to earn as much at their job, or they may lose their job, or they may not be able to be strong enough if you're a patient to complete their job. And not everybody has disability insurance or savings to weather them through this storm. And so you would be shocked. I know I was shocked at the number of our patients who, when we started asking and figuring out, they're actually making a decision between their copay on their chemotherapy prescription, or their electric bill, or their food bill, or their grocery bill. And this concept of if they become immobilized and they need a wheelchair to go up into their house, there's no resources to build a ramp or to make modifications and so forth. So this concept of financial toxicity that you mentioned really is a scourge among cancer patients and families that we also try and shine a light onto. So yes, we're handling all of the medical treatment side of it with precision medicine and targeted therapy, but at the same time, we also need as much support as possible so that people and families going through this journey don't have to make even more sacrifices because of not being able to pay for basic things. And it's not as if these are people who've had jobs and who have been hardworking and never missed a payment, but many families are one paycheck away from not being able to pay their rent or for basic bills. And cancer, unfortunately, one of the many devastating aspects of it is the potential to wreak havoc on all aspects of life. So that's something that we try and focus on to alleviate.
No, and I appreciate you expanding on that and sharing that with our listeners. I was extremely impressed as I visited with a few different physicians on that topic. After I began to hear it spoken of often, I was like, well, what exactly is that? And to just know that Henry Ford as an institution, as significant of an institution as it is, not just in the Midwest, but serving patients across the country, that's a priority of theirs. And that's a conversation at the table with the decision makers like yourself and Mr. Lassiter and others.
Yeah. Well, Wright has been an amazing CEO, and you mentioned Wright Lassiter, and I think that our commitment to this is that's how we lead. That is what we lead with, because we want to be the solution for the entire person, the entire community, not just when they happen to be, in their appointment dealing with the medical issue. So that's something that is critical, and Manny, I want to thank you for your support for Game on Cancer, and you may not know this, but when you stepped up and when this enterprise donated, it forced a lot of other people to say, well, maybe I should do it too, and it matters. I mean, it does create a crowdsourcing sense of we can actually make a difference. So thank you.
Yeah, we appreciate that, and I love it. R.J. King often speaks about the rising tide lifting all boats, and
yes.
We try to do our best to do our part and be a part of the solution. It's the aggregation of marginal gains, right? It's the aggregation of marginal gains.